was hoping we might be able to discuss. So this idea of institutional betrayal, I think we're kind of in that realm. Victim vulnerabilities. So basically that adults experience authority bias, the tendency to comply when a doctor's name appears on paperwork, and cognitive aging slows fraud detection, health anxiety heightens fear, making free testing kits seem like lifesavers. But if you get a free testing kit, you're literally giving away your medical information in the process. And if that is a fraudulent sort of endeavor, that could not turn out good. So, and the emotional toil on victims is quite severe. Shame, self-blame, sometimes suicidal ideation. One longitudinal study found fraud victims' depressive symptoms rival those of violent crime survivors. Regarding institutional betrayal, there are studies that show institutional betrayal predicts PTSD and depression over and above the original harm. Patients that feel gaslighted, essentially if Medicare can't protect me, who can? Perpetrator psychology. So there's a classic fraud triangle here. Pressure, opportunity, and rationalization still applies, but recent research adds a fourth side, capability. And so many indicted clinicians possessed insider EHR access and billing expertise, giving them the keys to the kingdom. And so, moral licensing also playing a role. I work 80 hours a week saving lives. I deserve a little extra. Small infractions snowball. And then the dark Machiavellian triad traits, personality traits, Machiavellianism, and psychopathy surface in white-collar settings. And they exploit opaque systems where harm feels abstract. Finally, we've got moral injury among honest clinicians. Picture an oncologist who spends evenings explaining to patients why their insurance flagged necessary chemo as suspicious. Well, this is kind of what you were bringing up. After the crackdown, she did nothing wrong, yet she absorbs the patient's rage. That is a moral injury. The erosion of professional identity when the systematic failure violates one's core values. Two more. So we've got also trust erosion in the public, right? So Gallup polls show trust in physicians' ethics fell from 67% in 2021 to 53% in 2024. So each scandal nudges the slope steeper, and the result is we get this defensive medicine where patients demand extra tests or avoid care entirely. Public health models warn of potential feedback loop. The more fraud, the less preventative screening, and the higher future cost. Okay, and so finally, and then I'm gonna close my mouth and.
No, those are such great notes, Dr. James.
Okay, great. So final one, and then let's discuss. And then finally, group level cognitive biases, where we have the normalization of deviance, where every peer clinic seems to bill just a little extra, the aberrant becomes the ordinary, and we have complexity camouflage, where fraud thrives in confusing billing codes. Oversight bodies experience information overload, a modern cousin of inattentional blindness. In short, healthcare fraud is both a financial heist and a psychological assault. Healing must therefore engage wallets and minds. And I have more, but I think that definitely this is a pause.
You're not kidding, because we're at something that I allude to in many Karma Club rooms, because from having been around but not in the healthcare system. In other words, I don't have a dog in the fight, so I can't, except my own body. So I can't, I don't benefit from anything. So I kind of want it, swept out from an objective standpoint. And I just can't figure out how best to do it. But, sending Doge in there to get rid of waste, fraud, and abuse seemed like a good idea. And maybe they did and will, get rid of some of it. But the other thing is, everybody's been saying we've had, all these inspector generals in there forever. And how come they didn't get it? They didn't catch it. And that's a very interesting question. So I'm hoping that waste, fraud, and abuse are something that artificial intelligence can get.
Don't gaslight your own body, Dr. Francine. Of course, you have a dog in the race here. I mean, this impacts you, everyone you know, your communities.
No, I understand, but what I'm saying is that one of the things that I believe is that way too much medicine is used on people my age. You know, and let me parentheses that I'm 84. We get a lot of medical care. We're the people who get those catheters and glucose monitors and so on that Medicare pays for. And, and yet it's very hard to justify the cost benefit on us at this stage in our lives.
Yes.
So we need to have some kind of larger palliative care system for people who can't be cured.
Thank you, Dr. Francine. And I'm going to ask a question not to answer, but to also kind of do a segue to everyone else who hasn't spoken if you'd like to speak. But just imagine you're on your deathbed and you're in kind of institutional care and you are given a unnecessary skin graft for part of some type of fraud. I mean, there are aspects of this that, I mean, it really did get under my skin. But if anyone else would like to speak or comment,
yeah, I mean, I was just looking up that in 2022, the Biden administration started a civil cyber fraud initiative. And it uses something called the False Claims Act, which has been around since, I think, like the Civil War, because people were charging the government for, weapons and all sorts of things. So this is not a new problem at all. It's been going on for years, and this investigation did start, I think, in 2022 because of the false claims for COVID. And they have recovered quite a bit of money from that. It's an ongoing problem. And the deputy inspectors that were all fired at the beginning of the Trump administration and replaced with Doge are the people that used to do this. So we already were doing this before Doge. They just renamed it and rebranded it and put in new people. And, maybe AI can help with it. I don't know.
Let me ask you a quick question about that. Both you and Dr. Francine brought this up. I mean, do you think that relentless AI surveillance of clinicians builds trust or breeds fear?
It depends if the AI is actually working as it's intended to work. We don't know.
Yeah, how do we know?
We don't know. And from my experience with AI, there's a lot that doesn't work in it. And I would not depend,
Mine too.
I would not depend on it for anything critical, really, without double checking it with humans. And does the money that you have to spend for serious AI?
This is just a context follow-up question to kind of deepen that. How willing are you to give? How much of your private data are you willing to give away to increase the reliability of these AI models? Is something I'm asking myself. Where do I draw the line?
Well, I actually think there's a